right. Our next speaker in this session is Dr. Elizabeth Robinson. She is a retired researcher from the University of Michigan, has been living in Ann Arbor since 1970. She began practicing mindfulness meditation in 1979 and has attended over 25 one-week mindfulness retreats. Her teacher training includes 2 mindfulness-based stress reduction trainings with John Kabat-Zinn, whom I think a lot of you would know. That was at the University of Massachusetts, and 2 mindfulness-based cognitive therapy trainings with Zindel Siegel and colleagues, I guess at the University of Toronto, was that? She began teaching mindfulness-based stress reduction in 2003 and has taught it to individuals in recovery, psychotherapists, medical school faculty, nurses, and other health professionals, as well as members of the community in Ann Arbor and Flint. She leads many drop-in meditation sessions locally and provides presentations to organizations and businesses on mindfulness. Today, she's going to talk about mindfulness, how and why it can support recovery from depression.
Hi. So I'm Libby Robinson, and this will be a kind of a different perspective than some of the other talks that you've heard today, because I'm not a neuroscientist. I'm a social worker and psychologist who ended up in the psychiatry department doing research on how people recover from alcoholism. And I put it together with my own personal experience cultivating, learning mindfulness, and had the opportunity to get trained in these models of teaching mindfulness outside of a Buddhist setting, which is where I learned it. Let's see, let's go. Which one? This one, yeah, right? That should work. Okay. What are you doing? Every system is different, right?
Yep.
All right,
This
so,
will take it forward.
Okay, great. Okay. So what is mindfulness anyway? Well, you hear about mindfulness all the time now. It's this buzzword. It's actually we actually have jokes about McMindfulness. But this is John Kabat-Zinn's definition, and he's kind of the guy who popularized this program that's gotten a lot of attention, and quite a bit of research has been done on it, on the particular model that he came up with. Mindfulness means paying attention in a particular way, on purpose, so deliberately, noticing the present moment without judgment, or at least trying not to get caught up in our judgments. Because when we really start to pay attention, we notice, oh, there's a lot of judgment here, isn't there? And actually, most lately, he's used this phrase, heartful awareness, which I really like, which I think emphasizes the fact that loving kindness and compassion are a really important component of cultivating mindfulness. So we can cultivate mindfulness in a number of different ways, most classically through meditation, which is how I learned it, but also just informally, just being more present in our ordinary lives. So I thought it would be helpful to give you a taste of mindfulness and lead you through a short mindfulness meditation. How many of you have some meditation experience? Okay, great. How many of you have had mindfulness experience? Okay, some. Great. All right. Maybe I don't need to do this for very long. All right. So sitting in a meditation posture, and your eyes can be open or closed. It's up to you. If you want to leave them open, if you're more comfortable with them open, let them rest on a neutral spot in front of you. So beginning by bringing attention to the physical sensations of sitting here right now at this moment. Maybe noticing the sensations of your feet on the floor. Maybe you notice whether or not your feet feel warm or cool. Maybe there's an awareness of your shoes and socks, your boots, perhaps. And then we can bring the attention up the body to the thighs and buttocks resting on the chair and noticing those sensations, whatever they may be. And maybe there's a sense of weight, pressure. Maybe an awareness of sitting on your sitting bones, or of your clothing, of your pants around your body, your lower body. And then shifting the attention to the hands. The hands are amongst the most sensitive of our body parts. So just noticing what any sensations there might be like. Perhaps there's a sensation of warmth or coolness. Perhaps there's an awareness that the hands are, the fingers are curled or straight. And you know that without even looking. And then noticing perhaps if the hands are warm or cool, if the back of the hand is cooler than the palm of the hand. Perhaps noticing any sensations where the fingers are touching another surface. Smooth, rough. Maybe noticing if there's, I like that, I don't like that. Just pay attention. And then bringing the attention to the sensations of the breath, wherever those are most obvious to you, whether that's at the abdomen, or the chest, or the nostrils. And just noticing those sensations of the body breathing. Breathing in and breathing out at whatever rate, whatever rhythm your body is breathing right now. Just noticing that sensation. And noticing if the attention wanders, which seems to be something minds do. And if you notice that it wanders away, bringing it gently back, without force, without judgment, just bringing the attention gently back to the breath for now. Just noticing that ongoing sensation of the body breathing. And then maybe you notice once again the mind wandering off. Maybe thinking about the future, what you're going to do next, what your plans are, phone calls you got to make, to-do lists. Or maybe the attention is drawn to something that happened before you got here, what you had for lunch. Or maybe the attention is drawn to some other aspect of this present moment experience, maybe sounds, or maybe there's a bodily sensation, another bodily sensation that you become aware of, an ache, a pain, just noticing. And then letting it go, whatever it was, not holding on to it, not pushing it away, but just letting it float off, letting it be, coming back to the breath. Back to this breath, just as it is. This sensation of the body breathing in and breathing out. So that's an example of a mindfulness meditation that one might practice. It's one of the classic ones, mindfulness of the breath. And it's an important part of the program that John Kabat-Zinn cooked up. But it's also something that you'll find, of course, in a lot of other traditions, right? Isn't it? If it's like, this isn't new, you may be thinking. Well, let's look, meanwhile, for now, let's just look at MBSR, mindfulness-based stress reduction, and learn a little bit more about that, where it came from, and what it's about. And does it seem to help people? John Kabat-Zinn was sitting at the Insight Meditation Society in Barre, Massachusetts. He was a longtime Zen meditator, and he came to this American Vipassana community and was on a long retreat and had this thought, this insight that one could teach this basic idea of the value of being present to people to help them cope with anxiety, stress, depression, pain, physical pain. And he developed this 8-week program to teach people how to cultivate mindfulness through meditation, both sitting meditation as well as movement meditations, and informal practices, noticing one's own present moment experience in ordinary life. As I mentioned, it's a secular class, so it's not, it doesn't really reveal it's the fact that John has this Buddhist background, which is only somewhat helpful, I think, in terms of understanding what we do. And it was originally taught to people who were coping with severe chronic pain, like the roofer who fell off one too many roofs and was struggling with severe back pain that was not helped by medications. Much of the research on mindfulness has been carried out on this particular mindfulness program, which is the main reason I'm taking the time to talk about it with you. It's also the one that I teach, but that's another matter. And there are lots of variations on it that have been developed, including mindfulness-based cognitive therapy of depression, which I'll talk about in a few minutes. But also one's focused on eating disorders, one's developed for teenagers, one's developed for caregivers of people with dementia right here in Ann Arbor. We've got such a program. And for people with PTSD, Tony King at the VA has done a lot of work on that. So what are the benefits of those? So when you look at the research is growing by leaps and bounds. It still, of course, has a long ways to catch up with a lot of other fields in medicine, but what do we know about the benefits? There's now much more sophisticated studies than there used to be, and we've also now got neuroimaging studies, which are very often paired up with some paper, pencil, and behavioral studies. The documented effects include reductions in rumination, which we know is something that tends to happen when people become depressed. Stress, which of course aggravates depression, and we're more susceptible to stressors when we are depressed or anxious. Emotional reactivity, a little bit less likely, I've certainly noticed this, a little bit less likely to get pissed off at that other driver and honk my horn at him. But just generally, just that emotional reactivity is reduced. Reductions in depression, anxiety, substance abuse, eating disorders, and ratings of pain. We also see, on the positive side, we see increased attention, increases in working memory, more cognitive flexibility, greater immunological response to the flu shot, say, or some other immunization that you may get, reduced blood pressure, and cortisol, one of the stress hormones. There's also increased psychological well-being. People report, and these are squishier kind of variables. greater relationship satisfaction and enhanced cognitive functioning, particularly amongst the elderly. It's not a bad thing if you're getting up there. Okay, so this is the cover of the latest edition of Mindfulness-Based Cognitive Therapy for Depression, which Siegel, Williams, and Teasdale came up with. They were cognitive behavioral therapists, researchers at Oxford and at the University of Toronto. And they developed an 8-week program based on mindfulness-based stress reduction and cognitive behavioral therapy. And it's been investigated by them and others with some fairly sophisticated research designs and some decent-sized samples. And I understand most recently they've started to do some neuroimaging work as well to back up what they've found. So I thought it might be helpful for you to know a little bit about what this program is like. There are 8 weekly sessions for 2.5 hours each week with a day-long retreat between weeks 6 and 7. Each week, people will sit and meditate together for 20 to 40 minutes. Sometimes it's 2 20-minute sittings. Sometimes it's 1 40-minute sittings. Depends on the teacher. And home practice with guided meditations is assigned. All of these mindfulness-based interventions use guided meditations. And it's kind of fun as a teacher when people say, but I'd like to try it without the guided meditations. Great, go for it. So these are what we do each week. In the first week, we'll talk about automatic pilot, how this tendency of our minds to just run in those well-worn neural pathways that they've always run through. Like every time I drive by Easy Street, I think about my friend who used to live on Easy Street, right? I mean, that's a fairly innocuous one. But there are other well-worn neural pathways that we have that maybe aren't so very beneficial. But we want to become aware of those. That's really the first step of what we're working on in mindfulness, becoming aware of what our minds are up to. And the first meditation we do is the body scan. Then we talk about the topic of living in our heads and how much we live in our heads. There's some really interesting neurological literature coming out now on the default circuit that our minds tend to go to. Most of the time, our minds are drifting off into self-referential thoughts, those sorts of things, and much more focused on me and what's going on with me than noticing what's going on in the present moment, just the physical sensory experience of this present moment. And at that point, we would introduce mindfulness of the breath. In the third class, in the third class, we will talk about, we will teach people walking meditation, or possibly easy mindful yoga. It depends on the class and the teacher. And then a nifty little meditation that Siegel and all developed called the 3-minute breathing space. There's a big emphasis on recognizing aversion, recognizing our wanting to push things away or our holding on to things. We may be surprised to find that we're holding on to those depressive thoughts or that anxiety. And can we learn to just let them go when they arise? So a lot of the meditations are about letting go, not holding on to those well-worn neural pathways when we become aware of them, but just coming back to whatever the focus of the attention in that particular meditation is. Maybe it's the breath, maybe it's the body, as in the body scan, maybe it's walking meditation. So we really, by the time the class is over, I've taught people about 10 different meditations that they can use on their own. So which one do you like best? Somebody did a study, and people are most likely to meditate if they're meditating, if they're using a meditation that they like. Ah, what a radical thought, So let me teach you a whole bunch of them, and you decide which one you like, and do that one, but do it. That's really one of my big emphasis that I put in my class. Um, Also in these first classes, we start talking about pleasant events. We have them keep a little calendar of pleasant events and unpleasant events, and then talk about it at the next class, and then the assignment for the next week is noting unpleasant events. And then we can kind of find out, well, what is my experience when I do have a pleasant event? Well, I didn't notice any. Well, I noticed a whole bunch, but I couldn't tell you how I felt physically. So just noticing, what is our experience? Really paying attention to it in a way that we typically don't. Allowing, letting be is a real important piece, and it kind of evolves. And thoughts are not facts, which is one of the most cognitive behavioral segments of the program. A retreat day, which is absolutely lovely. There's going to be another one tomorrow. And then starting to wrap up the class. How can I best take care of myself, and using what has been learned? So, does this make a difference to people? I mean, this is only 8 weeks. How can we rearrange what's going on in people's minds, in people's brains, around depressive thoughts, these well-worn neural pathways? And the amazing thing is that it does change. I mean, I'm impressed by this. This is a survival analysis from 2010 that Siegel et al. Published in showing, comparing the MBCT, which is the solid line, and the dotted line is maintenance antidepressants, and then the little one, the one that falls off there, those are the placebo folks who didn't get any medication at all. Okay, so the mindfulness-based cognitive therapy, MBCT, such an awkward name, is as good as maintenance antidepressant medication, psychotherapy, psychopharmacology, at preventing relapse to major depression. Which is really interesting, I think. And because there are plenty of people out there who don't want to take an antidepressant, or the antidepressant doesn't work for them, or she's pregnant, or something else, or it has a bad effect on them, or something like that. So we need other options. Yes, we still had some, a group of people. This is over 2 years, 600 days, almost 2 years. Still, people relapsed, but I'd like to see what the follow-up is. Do the people who relapsed at that point, do they do better? So one of the things that happens, let me talk about. One of the things that's interesting about so there's an 8-week program, right? It's just at the very beginning of this thing, but there's some kind of learning going on at the brain. Changes in how the brain processes information that supports managing one's depression and depressive thoughts and feelings when they arise in a different way than we had before. So this Holzel and Lazar published this really fascinating review and synthesis article looking at neuroimaging studies, self-report studies, behavioral findings. And this is their hypothesis about what explains the changes that we see. Attention regulation. People get better at noticing where their attention is and shifting it without pushing something away or holding on to it, but just letting it be. Oh, I want that chocolate. Okay, I don't have to have that chocolate. I can just go and do something else. I can pay attention to something else. So greater ability to regulate where our attention is. Greater awareness of the body, of physical sensation. We emphasized a lot of using our 5 senses as a focus for the attention, because the information that we acquire from the 5 senses are always in the present moment. the sensations of sitting in your seat right now, the sensations of the body breathing, the sensations, excuse me, of what you just last ate, maybe, or any sounds that you're hearing. Those are all present moment sensations. So we can use those as a way to touch base with the present moment. Oh yeah, this is the present moment. And we can start to notice when we're getting lost in a train of thoughts, in a whole story, a whole scenario, a little video movie we've got going in our heads about what's going on and what explains what happened with this other person and how they're picking on me or whatever, the thing is that arises in the mind. And part of what shifts is this emotion, our ability to regulate our emotions. One is through a reappraisal, which you gave a great example of that, One day I'm feeling great, and the next day, same situation, and I see it totally differently. And yet we become aware of that, and we become aware that we don't have to jump to conclusions that, well, the reason that my friend stood me up for lunch is because she hates me. Maybe something happened. We no longer interpret these things quite as personally. So there's a greater ability to entertain other possibilities than those well-worn neural pathways. Another thing is that because we notice what arises and then we let it be, gradually those experiences become extinguished. We become exposed to them, we let them go, and they weaken. We're not so caught by that sense of fear or by that anger or whatever it was that reached out and grabbed us. The more we let it be, the less likely we are to bite. Pema Chodron has a great book out called "Don't Bite the Hook," which is really apt. But part of what we're trying to do here. And then we also see people's perspective on themselves, on who I am, changing. Getting back once again to what you were saying earlier about shifts in who I am. Well, I'm not those thoughts. Those thoughts come up, but that's not who I am. I'm not sure who I am, but I'm not that thought, And getting a better sense of what one's possibilities are, and a little bit less likely to be trapped in those assumptions about who I am and what I'm like. And another big piece is compassion towards self and others, which is very deliberately cultivated in all of the mindfulness-based interventions. Now, for those of you who are into anterior cingulate cortexes, I thought I'd throw this one up at you. But this is also drawn from that article by Holson Lazar on which areas of the brain and which kinds of experimental findings support those mechanisms. And I'd be happy to share this with you. But I want to keep charging onward. So the informal mindfulness practice, I'm not going to take the time to do that, but the little thing that we did at the very beginning of the meditation where we brought attention to the sensations of sitting here right now at this moment, that was an example of an informal practice. You can do an informal mindfulness practice when you brush your teeth tonight. And just keep your attention on the sensations of brushing your teeth. And you will probably notice that your mind wants to go wandering off, and maybe you even want to go do something else as well. Look out the window and turn on the water and talk to the cat or whatever, But just notice that there's that, okay? That's what your mind wants to do, and bring it back to the sensations of brushing your teeth. And then just do that over and over and just noticing where it goes. It's really kind of interesting to see what our minds are up to when where the mind could go. So there's some examples of informal mindfulness practice: eating, showering, brushing your teeth, making the bed, folding clothes, listening to music. Although music is kind of a mixed bag because it tends to lead our attention in a certain way. So being aware of when that occurs, and maybe we go, I don't want to do that right now. That's okay, but just being aware. I can never remember to do the last one because I'm moving out of bed too fast. I'm getting better at the last one, getting into bed. Cultivating compassion is always included in mindfulness-based interventions, whether it's explicitly or explicitly. It's much more of a part of mindfulness-based stress reduction. The mindfulness-based cognitive therapy people kind of make it implicit in a lot of what they do. So they don't teach a loving kindness meditation or something like that. But to me, it is essential to cultivating mindfulness so that we can hold what we learn about our crazy minds gently, so that we don't bring judgment to that experience, so that we can let it be. Oh, yeah, look at that. Oh, there I am, and there I am judging this person because of the way they're making their tea. Well, that's ridiculous. Can we hold that very lightly? And one of the ways that we can hold it lightly is by being kind to ourselves, not judging ourselves when we find ourselves having negative assumptions about other people and what's going on with them. Okay. How much time? 3 or 4 more minutes, okay. All right, so let me just jump ahead here. I was going to lead you through a compassion meditation, but you can go on the web and you can find Sharon Salzberg. And she's like, if there's a loving kindness guru, she's it. But that's definitely been one of her big things. And there's a mindful self-compassion that an 8-week course that's been developed by Kristen Neff and Christopher Germer. She's at the University of Texas. And that's taught here in Ann Arbor a couple times a year, if you're interested in that. There's a couple useful apps, Insight Timer, Headspace. But you can check these teachers out on the web and listen to them, watch them on YouTube. There's an hour-long thing of John Kabat-Zinn at Google, which is a kind of interesting thing to watch, in his pink shirt. Locally, the Ann Arbor Center for Mindfulness, which I'm a part of, we teach classes and lead drop-ins. Whoops. I don't know what I did. And then another website called Mindful City, which posts a lot of other activities in the area. There's a couple Buddhist groups that deliberately focus on mindfulness, Insight Ann Arbor and Still Mountain. And occasionally you'll see classes being taught by Jewel Heart and the Zen Temple. I don't know about the local Hindu groups. They teach some, probably, perhaps, I don't know. But I'd love to know, because I'm always interested in being able to help out. One of the interesting things to me about mindfulness is that when you really dig into it, it turns out that every major religious tradition has a strand that focuses on cultivating mindfulness, whether it's the Catholics centering prayer, the Quakers and their services, the Sufis, particularly the work of Rumi, and certainly what I've heard today. This isn't anything that's just strictly Buddhist or even particularly religious. It turns out the Greeks and the Romans also talked about the importance of being in the present moment, being here now. Marcus Aurelius, and of course the American transcendentalists Henry David Thoreau and Ralph Waldo Emerson did so as well. So, any questions?
I had a question that's kind
Sure.
of maybe was a running theme through the talks about this time scale, this issue of time scale. Like that if you had a behavior that you were engaging in for 10 years, then would a 8-week retreat, how much of a dent it would make into that, or would a, directly manipulating the structure of the brain. So maybe it's a question to everyone.
Certainly not going to be as instantaneously as some surgery.
Yeah.
But, and I think what I would say is it's a chip away at those sorts of things. There's an interesting book called 10% Happier. Can we ditch at least 10% of our depressogenic thoughts that plague our minds? If we can do that, that's a good thing, right? And is that what happens in 8 weeks? I'm not sure, But there's definitely, my theory is that people learn to cope with these difficult experiences when they arise in life, which they will, things happen in life, right? Good things, bad things, how do we react to it? And maybe we react differently to them now than we did before.
I don't know if there's an answer to this. It's kind of, how do you address the issue of if someone has the motivation to learn a new skill and then to actually practice the skill and actually integrate it into their own life, what if that's the very set of skills that are kind of missing or causing them to kind of dive into their depressive states? I mean, do you know what I'm saying? It's like their inability to actually stick with something or to get something generated or to actually, make a practice happen.
Yeah, so the depressed person who has a hard time even coming to a class, let alone doing a weekly practice. Yeah, right. I think that may be the kind of situation where waiting until the person has recovered a bit more from an episode of major depression would be helpful. The original MBCT model is on people who are in remission from a major depressive episode. But other people have applied this to people with active depression, including people who are suicidal. But I think you would want to be sure and build in a bunch of ongoing supports so that, if I have a suicidal thought between class 2 and 3, I can call you and you can help me figure out how to work with that in a way that's constructive. And so I would think that you, as a mindfulness teacher, you'd want to have a lot more tools at your disposal than just mindfulness. Yeah. Thank you. Other thoughts? Yeah.
Yeah. Trying to understand the mindfulness a little bit more. When you said brushing your teeth and practicing mindfulness, right?
Right.
So a certain human being will have a certain amount of cognitive capacity at a particular state of mind. And if it's saturated, I think that's where you're closer to the flow. So I'm referring to, by flow, what I mean is basically fully engaged, what I'm saying. So suppose solving a complex mathematical problem, the cognitive capacity needed is much more than brushing your teeth, for example. So just, for example, in the Miracle of Mindfulness, in the book, Thich Nhat Hanh says, all the miracle is when I'm pulling water, I'm only pulling water. So do you really think just doing a simple work and only doing it, is it what you mean, or just saturating your full cognitive capacity is what is more needed? Like trying to understand the practice better.
I think I understand your question. I think that when we're standing there, we're usually standing when we're brushing our teeth, right? No, it's like a little vacation from this busy mind. Wherever this little mind is that's, wants to go wandering off and think about all the class assignments I have to do and whether or not that friend is going to call me or whatever, the mind wants to think about, did I make a good impression today? Things like that. That's where the mind wants to go. It wants to be there. So this is a chance to kind of bring it back to just the physical sensations of holding that toothbrush, putting it under the water, putting that toothpaste on it. What does it feel like to put it in your mouth? What is the taste of the toothpaste? Really focusing on the sensations and not so much thinking about it. And if we notice the mind wandering off into thinking, we can, oh yeah, there you go again. Okay, come on back. Very gently, without force. So it's a chance to give ourselves a little break, as it were, from the constant mental stuff that we are caught up in so much of the time.
Why is it that when most people meditate, they close their eyes? Is there a relationship between focusing your mind to what you are trying to think about and the fact that you are not looking at other things? Is there some way of explaining that?
Well, actually, the Zen Buddhists meditate with their eyes open. The eyes tend to be kind of like at half-mast and kind of just focused on something in front of you. I can't do that. I think because I've just done it this other way for so long. I have some well-worn neural pathways there. But you can do it either way. The thing is about visual stimulation can be very distracting. So if I'm standing here meditating, looking out at all of you, I think it would be very easy for my mind to get distracted by, oh, I really like that jacket. Oh, yeah, oh, that's really nice. Or, I like your hat, or something like that. But, so if we want, part of training the mind to be mindful is using these things like the sensations of the body breathing or other physical sensations or sounds as the focus of our attention during that meditation. And if we can even actually use a visual object as an object of attention. So you can do it. It's just a little bit harder. That's my experience, and that's what a number of my teachers have said as well. But try it. Try it both ways. One of the things that's neat about mindfulness is it's very much about cultivating curiosity. Well, what's it like to do it this way? What's it like to do a walking meditation in my shoes and socks? What's it like to do it in my barefoot feet? Just noticing things like that. So there's nothing sacred about it being closed, your eyes being closed. If you're, and certainly there are going to be settings where we're going to be more comfortable with our eyes open. Yeah.
So drawing on your last comment there, it seems to me that this tendency towards self-referential thought arises out of a lack of novelty in the objects in our environment. And it seems like all of these practices reintroduce that novelty into the environment, and so that our focus comes back out of us and into the evaluation of the objects in our environment, whatever those things may be. And that seems to fit in line with the idea of letting go and of reevaluating experiences and things like that. How much do you think our having defined our environment drives self-referential thought and the diminishment of mindfulness?
Our particular environment right now with all of these distracting devices and so forth, is that what you're thinking?
I mean objects and labels in general.
Uh-huh.
So the tendency to label objects,
right,
and then once we have applied a label,
right,
to no longer look at the objects, but only look at the labels. And
right,
once we
right,
have labeled all novel objects in our environment, they fail to be novel anymore.
Right.
And so
then we get bored. And then we cook up things in our brains.
Well, the only thing left to look at that we don't understand is still ourself. And so it drives this kind of...
So it could be, you're suggesting it could be a recursive thing that we get caught back up in self-referential
Yes,
objects.
it drives
right,
rumination.
Right. Well, one of the things that you want to do if you're cultivating mindfulness is really focus on the direct physical experience. So noticing when I'm thinking about brushing my teeth, or I'm thinking about the breath. I'm not actually experiencing the breath at this moment. I'm thinking about it. Oh, okay, well, I can let it go. I can go back to the direct experience of feeling the body breathing, and really make that the focus of attention. And noticing when the mind wants to go wandering off, and oh, now it's thinking about whether I'm breathing right, or it's thinking about whatever. Just noticing what the mind is up to without pursuing that line of thought. And yet we may turn around and realize that, oh, gee, I just spent, the last 10 minutes of my meditation planning what I was going to say at the Vedanta Symposium, So, the mind is like that. I'm hardly enlightened and completely in control of my mind. But can I notice? Can I notice that it does that? And then choose to bring it back. Oh, there it goes again. Okay, coming back. Without judging it, without judging myself. That's just how minds are. I was at a retreat / research symposium with Joseph Goldstein and a whole bunch of scientists in this area, and somebody asked Joseph, who's a very experienced meditator, do you think the mind is ever still? And he's meditated as much as I think a monastic would, even though he himself is not. And he said, no, I don't think so. And then that sparked this whole conversation in the group about, well, why are our minds like this? And when we were coming up, evolving on the savannas of Africa, it was really important to be a very alert mammal, to be very aware, to be cautious. And so that, our minds our brains are kind of geared to notice those sorts of things more than it is, oh, wow, look, the sun is shining, the flowers smell beautiful, whatever, So we can just notice that there's that tendency that we're carrying around. Do we need to have that run our lives? We can choose. Other thoughts that people might have? Questions? Okay. All right.
All right. Let's thank all three speakers once again. All right. So thank you all for coming. This was our first Arbor Vedanta Symposium. Hopefully we'll do one again next year, and again we'll pair Vedanta with some other topic of general interest. So, thank you all.